Welcome to Mindful Me. I'm your host, Dr. Marga Zarraga, family medicine physician and wellness coach based in Greater Boston. This health and wellness show was born out of the needs I saw as a medical doctor. People are curious and are even demanding information and options on how to get healthier and, more importantly, to improve their quality of life. And what is quality of life? But feeling good from moment to moment, minute to minute, hour to hour, and day to day. It's my goal to highlight to you, our viewers at home, the knowledge and experience of various experts from both mainstream and complementary disciplines to inspire action in our communities. And this self-care that we're talking about here is physical, mental, and energetic, all around. Today's guest is Salvatore Viscomi. Dr. Salvatore Viscomi is a practicing physician, professor, researcher, and entrepreneur. He currently leads Good Cells product line of genetic and biomarker testing, developing a healthcare platform that harnesses the power of blood to both inform and restore health. Previously, Dr. Viscomi spent 14 years as a member of Harvard Medical School's faculty at Brigham and Women's Hospital, where he was also a resident and fellow before that. Dr. Viscomi served as an executive and board member of Fremont Scientific, where he led the development of a next-generation blood product management solution through FDA approval and ultimately to market. Today, Dr. Viscomi is sharing with us his expert and, may I say, rock star knowledge on the topic of genetic screening and how such technology is available for those of us looking for a preventive and proactive approach to long life, not just for ourselves, but also for our families. Dr. Viscomi is also an assistant professor at UMass Medical School and a board member of Make-A-Wish Foundation. Welcome, Dr. Viscomi.
Thank you for having me, Dr. Marga.
This is so interesting. You are in such an exciting field, and you're at the forefront, a frontliner at all of these biotechnological advancements. But for this first episode, I'm just excited to hear more about how you guys are advancing genetic screening and making it available. If you could just touch on how what's happening there.
Sure. So genetics has been around for a little bit,
Yes.
and most people think of genetics as inherited, what we get from our parents. But there are two sides of genetics. One is the inherited side, which is very powerful.
Yes.
But then there's the genetic that changes within our bodies because of exposure to different things, stressors, smoking, sunlight, radiation, or random events, random mutations. And so that's an important part of genetics as well, that we are now able to identify and track over time. So whereas the inherited stuff is fixed, you know, what you're born with you cannot change in terms of genetics, but there is another form of genetics that is changing every day, and we can measure that. So that's important. And so the combination of understanding that genetics is important for an individual because you can identify your risk for disease. The one thing about genetics is that everyone thinks if you have something, that means you're going to get the disease. Genetics, for the most part, says that you are at risk for disease, and the genetics that I'm in favor of promoting are the ones that are actionable, meaning that if you are identified as a high-risk individual, there are things you can do to offset that risk.
I think that's very important because as a primary care doctor, when we prepared for this show, the actionable is really resonated with me as obviously a lot of patients come to me for advice. And when it's important because what I'm getting from the front lines is some anxiety in terms of what those testing can reveal. So what exactly is the experience of a person who does genetic screening in this day and age?
Sure.
Is it a blood test? Go ahead.
Yeah, it can be done in multiple ways.
Yes.
The most common are saliva or blood.
There you go.
But you can test for a lot of things, but more is not necessarily better.
There.
So the genetics that I am a part of, that I promote, is the ones that are actionable. And that's decided by a committee, by an organization called the American College of Medical Genomics and Genetics, that establishes which are the genes that we should be testing for in the population, because those are the ones you can make a difference for. we can test for things and tell people you have a risk for X, Y, or Z disease, but if there's no treatment for it, if there's no way to monitor for it, you just created anxiety and you created a new problem. So the idea is to focus the screening on things that people can have power over. So they can go perhaps change a diet, exercise, they can take a medication, they can see a cardiologist for a stress test. There are things they can do over time to monitor whether they actually will get this disease, to prevent it, delay the onset, or minimize the symptoms. So that is an important point that you made, is that we really want to focus on what's actionable, and that means that there's something very specific you can do that should relieve anxiety instead of create anxiety.
Couple of things are coming to me right now just listening to this. How about families with a particular propensity for particular diseases? It's coming to me that those kind of families, patients with cancer family history, heart disease history, diabetes history, have you seen results for those that are extra useful, I guess?
Yeah, absolutely. So one of the first steps is to understand whether you should have some genetic testing, is to fill out a questionnaire and to talk about your family history, your personal history. When it comes to family history for breast cancer, is how many people in your family had breast cancer? How far removed were they a parent or a grandparent, or was it a third-degree cousin? At what age did they get breast cancer? All those things matter in terms of identifying your risk. And the one thing about the genetic, it doesn't mean that it captures all of the cancers. Where we are now, it captures some. So just because you do the test and it says you may not have that predisposition, it doesn't mean you can't get breast cancer. So we still want you to do your mammography, your MRI if you're high risk, but we want to tell people that we know that they're high risk for, that we want to screen you very early. Different than what the normal guidelines are. So if you normally were going to get your mammogram at 40, perhaps you start at 30. And so that's where the actionability comes from, that you would change behavior. If you knew that you were at risk for heart disease, that you would see a cardiologist as you're earlier on, that you may start taking medication earlier on. But ideally, we like to do things that are easy to do, like diet, exercise, so you have control of decreasing your risk.
I think that's very important that people differentiate that there are existing guidelines for the general population. And what you're saying is this can possibly empower those individuals with more motivation because they have this information that I would say sets them apart for something more specific, and the intention and the purpose is more specific, and the monitoring will be more specific, right? Versus what is regularly done by the general population. I'll give an example. This is not through genetics, but so I'm Filipino by heritage, and I've been informed because I've practiced in the U.S. for most of my medical career, but I've been informed by my Filipino colleagues practicing endocrinology that the pregnancy guidelines in the Philippines, because of the genetic, the propensity of diabetes and gestational diabetes, or for the audience, diabetes and pregnancy, is much higher than in the US. So one of the conversations I've been in, I've actually just delivered my youngest child.
Congratulations.
Yes, thank you. Was we were reflecting how the guideline here in the US is different than in the Philippines. And that's based on the genetics, right? So there's general guidelines for the US, there's general guidelines for the Philippines, and then what we're discussing today is that there's going to be an individual guideline for a person or possibly for a family, is what I'm kind of extracting from this conversation. Yeah. And the mindset and approach of doing this is definitely proactive, as you said, action-oriented. You use the word actionable, proactive, action-oriented. Is that, like in other words, that's how to optimize and maximize what this is about. To me, it speaks of security, reassurance, all those things where, you know, instead of kind of leaving it to faith, instead of leaving it to fate, rather, we've kind of expanded what can be under our control. Not, of course, as we said, we talked about the anxiety of things. To a healthy extent, the information can give us more control. If you can comment on that.
I would agree with that, and I think, you know, to build on that, I would say that the advancements in medicine will have to be about precision, right?
Oh, there.
Meaning that you may have two individuals that ordinarily will look the same to the doctor, same age, same blood work, ordinarily blood work.
Yeah.
Same sort of risk factors from what they can understand from their personal history, but they're very different, and their genetics are very different, and they may be going down different pathways. And so this is where the genetics is one part of precision medicine, to say that there's something about you that's different, that puts you at higher or maybe lower risk, and we're going to treat you differently. If you're at higher risk, we're going to watch you more closely for very specific things. And I think that element of precision is what's going to make the biggest difference. That you are not just one of many with a disease, that there's something about you that's different, and you're going to be treated differently and monitored differently. And I think that's going to be important. We haven't done that in healthcare. We've sort of lumped everyone together into categories.
This is a very new concept. So after the break, if you could just like summarize that again, we'll go back to precision medicine after the break. Thank you.
Great.
And next up to the fridge is Nia. Here she goes. Look at that concentration. Will she knock it out of the park? She chose the apple. What an incredible choice. Every healthy choice can help reduce your risk of cancer. Champion your health.
It can be lonely living with memory loss or dementia. But you are not alone. Memory cafes are bringing people affected by dementia together at welcoming social events.
It's fun. I am so thankful to have a place where my mom and I can go and laugh and just enjoy the experience.
I've made new friends. They understand what I'm going through because they are living it too.
Memory cafes encourage me to try different activities, which is really refreshing.
You'll find guest artists, musicians and dancers, educational programs, or simply a place to relax and chat with others. These gatherings are free, and you can attend as many as you would like. Cafes are offered weekly or monthly, with options to meet in person, online, or even by telephone. Visit these websites to learn more and find a memory cafe near you.
We are back from break. Let's pause for our mindful quote of the day. The longest journey you and I really make is the journey to understand that there is no definition unless you create it. That the definition of who you are and who you're called to be in the world is yours. Rev Norm is the quote source for today. So yeah, we just try to plug in some mindful thoughts to keep with the theme of mindful me. But you and I were talking about precision medicine. So if you could just recap, because that's a new term, even for a doctor like me. But
Sure.
it captures the spirit of you know what we're of the topic today. So go ahead.
Sure. If we're going to have success in combating some chronic diseases, diabetes, cardiovascular disease, and cancer, we can't be broad. We need to look at all the pieces of information, every piece of data that we have, and that means a couple of different categories. We talked about the genetics, right, in terms of are you predisposed or not. So that's one part of precision. Two is, are there genetics that we can measure that's changing that we monitor over time? That adds another layer. And then ultimately, are there things in our blood that we can measure over time to see if something's an abnormality? And you combine that, and then you have and then you can also layer on imaging, right? Screening tools. It could be a CAT scan, it could be MRI. And you put that all together, and it's now about having all this information about yourself, as opposed to trying to rely on one thing.
Wow.
And so precision is really adding up all the tools that we have to our disposal and putting that information together to really identify what is the true risk and what is the appropriate therapy for that person, right? Because there may be more than, right now you get diagnosed with a disease and a doctor may have 10 different treatments that they're not sure which one to give you. But there probably is one that's better for you. And so the future of medicine is that we're going to know which one is the best one for you. And it's not going to be trial and error. We're going to know from the very beginning that this is the one that has the best success rate.
So what I'm taking away from that, I'm now walking through this as more of like the recipient or the patient of such an experience. And what you said was monitoring. So I was thinking genetic screening was a one-time deal. But from what you just said, it looks like if it's a monitoring situation, the future holds that there will be opportunities to repeat at intervals. Could you verify what I'm thinking?
Sure. I think, so we talked about the inherited genetics, and for a particular gene, that won't change. But the future genetics is what does change in an individual, right? What's personal to you? Meaning that at year one, there's a test that's being done and says that you may or may not have a certain amount of damage to your DNA, your genes. And then year 2, year 3, and at some point, it reaches a critical point where you may need to do some sort of additional screening and monitoring or treatment. But that's something where, that's the future of genetics, really. That's the exciting future, is that there may be things that you can do that will decrease the rate of that change, right? Some things we can't change on that, but things we can. So if you are a smoker, for example, we know that you are more likely to damage DNA, and we can measure that. But if you stop smoking, we can see how that's slowed down.
There you go.
We can see how diet changes things. We can see how if you exercise. But if you do have accumulated all this damage in it, there are things we like for you to do. We like for you to get a cardiovascular visit with get additional testing done. And so that's a new tool that we've never had before. We've always relied on blood testing and stress tests, but now we can rely on your inherited genetics, which you can't change, but you can know about, that's important. But we now can monitor your other genetics that is changing, it's very dynamic, and we can identify if you're at risk.
I've been using the word tool a lot in this show.
Yep.
This seems like a potential power tool, if I may, in prevention, right? And what's coming through for me is that patients have obviously different experiences. This experience is simply a saliva or a blood test, like you said, possibly a check-in at a determined interval, possibly customized or personalized to the individual, right? So it has this TLC approach versus I would say the alternative, which is being ill and undergoing uncomfortable, like example for cancer, chemo, radio, and all of that. Like, I think now as a primary care physician, being in the front lines, I'm listening to this, I'm feeling like my role is to present those two experiences so that you can raise the awareness and consciousness of patients to these, I guess, evolving choices that are available. And so I feel like after listening to this warrants further discussion and looking into for all of us, medical people who are catching this show, and non-medical alike, because I think, as you said, it seems to me like this is the frontier.
Absolutely. I mean, the biggest impact we can make in healthcare is to identify the disease before it starts or at early stages.
That doesn't always happen.
Doesn't always happen. And we know that treatments are advancing even for
Yeah.
things that are more have progressed. But ideally, the impact and the best experience as a human being is that you don't go through all those
Yes.
treatments, is that you identify, for example, in diabetes, pre-diabetics are usually don't know they're pre-diabetic, and there's about 85 million pre-diabetics in the United States. If you could make them aware of that and give them advice in terms of how to prevent them from becoming diabetes, then you prevent the renal disease that happens afterwards. You prevent the heart disease. You prevent the ulcers and the amputations, which are all awful experiences and also very expensive for you as healthcare. But if you can identify people when they are still healthy, and they can make that decision about, well, how do I stop myself from going down this pathway?
And that's an available experience that kind of is more familiar to most people, the hemoglobin A1C.
Yes.
What you're saying is there's a window earlier than that, possibly.
Right.
That's just one scenario where you capture it even much earlier.
Yeah. Well, it's both, right? I mean, this is where we want to use that personalized and precision approach.
Yes.
Is that
Yes,
we're going to
that's
look
right.
at blood tests, we're going to look at genetics, we're going to look at all sorts of genetics, and then that's how we're going to identify people early, right? It's going to be a combination. Sometimes the genetics will be more important. Sometimes it's going to be the blood work, depending on the disease.
That's right.
But ultimately, is capturing all the information we can from blood.
Yeah.
Saliva is really powerful in a lot of ways. It's easy to have access to. It doesn't provide everything you need for. It doesn't provide you for that dynamic genetic change that we're looking at. It doesn't have special cells that you could store for that we'll talk about in the future.
For the next.
But really, there's a lot of power in our blood, for diagnosing disease and also for treating disease.
You mentioned a term in previous chats we've had, the non-inherited disease. Non-inherited, to me, and please correct me if I'm correct, if I'm accurate. The non-inherited disease also reflects the damage that we're talking about, the DNA damage that could happen in a lifetime. Am I right?
Sure. Yes.
Yes. So if you could cover that.
The inherited genetic is the makeup of all our cells in our body.
Yes.
What
Yes.
happens with the non-inherited genetics is that certain cells will have some damage in the blood, and these cells may replicate faster, they'll multiply faster, and they become a larger and larger percentage of cells that are abnormal, and they tend to cause a lot of inflammation, and inflammation is really bad for our body. It's bad for susceptibility to COVID, it's bad for heart disease, it's bad for diabetes. And so the idea is to measure this damage that's not in all our cells, in some of the cells, and to see how quickly it's progressing, and then be able to identify people with that and see what you can do to slow that down. And that means they're going to be selected for other screening programs. They may be put on a medication earlier. But these are people that potentially don't have any inherited genetic abnormality, and their blood work may be seemingly normal. But there may be another part that's not being tested for today that is abnormal. And so that's the additional layer, that's the future of genetics, is this dynamic part, is that what is happening in some of our cells because of stressors in our environment. Lifestyle and potentially bad luck, and some of it is, mutations. Our cells multiply, sometimes they make mistakes when they multiply. And some of these mistakes can cause problems down the road.
This is somewhat related. in cardiology, where I did a lot of years with cardiology research and such before I went into family medicine. And so I'm remembering right now the Framingham study,
Right.
and how in cardiovascular studies, initially there was more information on males and as well as a Caucasian population. Given this genetic screening is based on current research, could you comment on what is the basis for the conclusions that we're making on what to test and so forth?
Yeah.
Go ahead.
So I think one of the weaknesses of inherited genetics screening is that a lot of the research and a lot of the databases were based on a pretty uniform, homogeneous population
Okay.
that was not inclusive of all
Yes.
of all of society.
Yes.
And so there are definitely organizations now that are looking at the different ethnicities and races to make sure that we are collecting data on them as well. Otherwise, if you're trying to apply data sets that are based on, Caucasians, you may not be capturing genetic changes that are more prominent in other races.
Yep.
So that needs to evolve.
Yes.
We've been behind in that. On the non-inherited side, it doesn't matter what race you are. It is what's happening in your body,
Yes.
regardless
Yes,
of
yes,
race.
yes.
and
That
ethnicity.
makes sense. That totally makes sense. We covered so much in our time together. If you could just summarize for the audience, like a takeaway message, I would say, on genetic screening.
So I would say that not all genetics is the same, and that not all of it is anxiety provoking. To speak to your physician about your personal risks, your family risks, and about being screened for things that you can do something about.
That's all.
And so to just to understand that the actionability of these things are things that are going to make you happy because you have control over them.
Awesome, awesome. So please, thank you again for joining us today in today's show. We will have a part 2, but the next episode with Dr. Viscomi will be on biobanking. And we're very excited for that as well. So please make sure you catch that episode. Look for Mindful Me and previous shows on Vimeo, Facebook, or YouTube under Dr. Marga Zarraga Mindful Me. To comment, the email is mindfulmetv@gmail.com, or leave us a voicemail at 617-874-1234. We hope you join us next time for another episode of Mindful Me.